So greetings friends, today let us discuss about total knee replacement post-op radiographs. So why do we really require a post-op X-ray? So the surgeon can actually foresee the failures well before they manifest clinically. So for example, in this case, in the initial post-op X-ray, you can see some anterior notching on the femoral side. So in such cases, the surgeon can either anticipate a periprosthetic fracture that is going to occur, or in case if the patient presents to you with a periprosthetic fracture, he can retrospectively analyze what had gone wrong in the initial surgery. So that is the importance of your post-op X-rays after your TKR. So what do you look for in your TKR? So once the TKR is done, you look what sort of implant has been used, what is the adequacy of the procedure, whether you have done your corrections well, whether you have got your alignment back, and how is the implant size, whether it is adequate, whether it is too large, or whether it is too small for the patient. Then you look into the patellofemoral joint, whether the extensor mechanism is going to function properly, what has been done to the patella, whether it has replaced or not, or whether there is any complications like a patellar fracture. And the overall complications in the follow-up, you can identify well with an X-ray. So what is the ideal post-op X-ray that you have to get? So a full-length hip to ankle weight-bearing radiograph is the ideal X-ray that you can get both in the AP view as well as the lateral view. So what happens is that once you load the knee, the true alignment of the knee can be assessed once you get the full-length X-ray. If there is loading, you can understand ligamentous laxity that is happening either due to a ligamentous insufficiency or if there is any polyethylene wear. Extra-articular deformities also can be assessed with these kind of X-rays. Now, if you don't have access to such X-rays, you can get short films as well. In that, you just have to see the anatomic axis of either the femur and tibia and then assess whether your implants are implanted well or not. Always don't forget to get a skyline view of the patellofemoral joint to assess the extensor mechanism. So this is what you can miss if you just get a short film. The extra articular deformity that has been operated previously will be missed if you just get a short film. Now coming to the implantation. So what do you look into? You see whether the implant that has been used is a PCL sacrificing implant or a PCL retaining implant. Then you use what sort of a fixation method has been used, whether a cement was used, whether it was a hybrid, or whether it was implanted directly onto the bone. Then you look at what type of insert has been used. So whether it is a fixed bearing insert or a mobile bearing insert. Then you see what sort of level of constraint the surgeon has been given to the patient.